2 meetings
for that perfect
about
and missed
economics, and I was really comfortable kind of with
everybody on
So
board.
that somehow the assumption.
Good afternoon, and welcome to the Voices in Leadership, a series focusing on the nexus of science and leadership to create positive change in public health. I am Betty Johnson, and I have the privilege to direct this program and introduce today's guest. Gil Kerlikowske is the former Commissioner of U.S. Customs and Border Protection and is currently an IOP Fellow at the Harvard Kennedy School of Government. But his public service can be traced long back before these prestigious appointments to police officer, detective, sergeant, lieutenant, and Seattle's chief of police for 9 years. He was President Obama's drug policy advisor, where he proactively welcomed non-governmental organizations and advocacy groups into policy conversations, ensuring that the focus stayed on public health. In his most recent role as commissioner, it is perhaps useful to think of the scale of the organization he led in terms of sheer numbers. It is the largest second contributor of funds to the U.S. Treasury, collecting $46 billion in fiscal year 2015. As the nation's largest law enforcement agency, it employs 60,000 people and has an annual budget approaching $13 billion. One can only imagine the leadership challenges that landed on his desk in any given day. During his career, Mr. Kerlikowske was awarded the Nathan Davis Public Service Award from the American Medical Association, led the U.S. delegation to the United Nations Commission on Narcotic Drugs, and was elected twice as president of the Major Cities Chiefs Association, which represents the largest city and county law enforcement agencies in the United States as well as Canada. In a word, Gil Kerlikowske has seen and done it all when called to help resolve complex service and organizational challenges in both the public health and public safety domains. Before I turn this session over to today's interviewer, Dr. Howard Cole, Harvey V. Feinberg Professor of the Practice of Public Health Leadership, please join me as we welcome Mr. Kerlikowske to the Voices in Leadership series at the Harvard T.H. Chan School of Public Health.
Thank you.
So Gil, welcome.
Thank you.
So you've had quite a career looking at the worlds of criminal justice and public health as a police chief, as director of the White House Office of National Drug Control Policy, most recently as commissioner. You've had many great titles. Now in academia, we at Harvard are proud to call you fellow.
Thank you.
The pinnacle of your career, right? So let's just talk about leadership from those multiple vantage points. Let's start with the White House Office of National Drug Control Policy, where actually people refer to that position as the drug czar. Tell us more about that office and what it's like to have a strategy on drug addiction, and particularly the opioid crisis right now.
I didn't care much for the czar title, but my wife loved being called the czarina. So, it's a very small office, about 100 people, and it was brought together in the late 1980s to knit together all of the different kind of equities and assets in the federal government to deal with the drug issues. And at that time, of course, a famous Boston case, Boston basketball player that had died of an overdose. But you could see that there were lots of disparate functions. The Department of Justice in the Drug Enforcement Administration would operate one way, and the Department of Education thought they had a different role, and on, and HHS. So bringing everybody together to the table to write the president's drug control strategy hadn't been done in a number of years. It was mostly dictated from the White House under the Bush administration. And when I brought everybody together, the Department of Education mentioned, we haven't been at the table in 6 years. And once you have everyone at the table, it makes a huge difference for the outcome and a huge difference for who's going to support it after it's written.
And then you had to balance not only reducing demand, but also reducing supply from the international point of view. Can you comment more on that?
You always lead this delegation to the United Nations with a very large number of countries that meet once a year in Vienna, but then have multiple other meetings. And they all have different policies and different programs, whether it was Colombia or whether it was Bolivia when it came to cocaine issues, or whether it was Afghanistan when it came to opium and poppy issues, or at that time, President Obama, early in his administration, pushed the reset button with Russia. And so we had multiple bilateral discussions with them about how to reduce opium, how to reduce cocaine, because if we can do that and improve the lives of people in those countries, oftentimes it certainly helps us.
So from a leadership point of view, how do you get people to work together, both in this country, abroad, from all these different perspectives?
I think the best thing in many ways when you talk about drug abuse, drug dependency, addiction, organized crime, is that it's not a partisan or a political issue in any way. People want their children to be safe and free from drugs. People want to see the money cut off from cartels, and they want to see those that are heavily engaged or those that are engaged in drug trafficking to be prosecuted, to be successfully prosecuted. And so I think most people came to the table thinking that these were the goals. How you go about trying to figure out how this is going to work. I mean, you think about the three Central American countries, a good part of their GDP is, and these are in Guatemala, El Salvador, and Honduras, a good part of their GDP can come from drug sales or organized crime. How do you reduce that?
As you pointed out, this is a really bipartisan issue in American politics and public health right now, isn't it?
One of the few.
Yeah. And then tell us more about the intersection between incarceration rates in federal prisons and the drug crisis right now, and how we should address that as a society looking forward.
Well, when I first got the job, President Obama and the staff were very engaged in the economy and jobs. And I had a pretty free hand. So the good news is I had a pretty free hand. Bad news is the president wasn't as engaged in this issue as he was in economic issues. So I got to kind of chart that course with the help of, well, people like you and the Department of Education and others. That worked out, I think, to our advantage because we wanted to not just look at the drug problem in America as a criminal justice issue. Aren't the police going to do something about it? Isn't DEA going to do something about this? But how can we address this much more holistically? And I used a statement that we wanted to be smart on drugs and that we're not going to arrest our way out of the nation's drug problem. That meant health and education had to be key partners.
And so we're 15 years into this opioid crisis. All the statistics look like they're going the wrong way, except for possibly opioid prescriptions now being reduced a little bit. Do you want to just comment on the future? How is this all going to play out, do you think?
You know, I'm not sure. When I took office in 2009, the captain in charge of the narcotics unit in Seattle said to me, he said, you know, one thing you might want to look at, there's some issues around opioid prescriptions and pills. Honestly, I had not heard of it. My colleagues in law enforcement hadn't. And then I began to look for the public sources. What are the articles? Who's actually talked about this? In the health field, there were certainly articles, but it was also almost always among subject matter experts. It was an unknown issue. Then people like Governor Beshear, Governor Shumlin, and many others recognized it and took it on. And once you elevate it to the general discussion, you really get that opportunity then to bring other resources and, frankly, fresh eyes to the problem. I'm concerned about the future on it because I don't think in public health we've done quite as good at giving physicians other resources to deal with pain management. And I'm very concerned that if research dollars are cut, the research is going to lead to better ways to manage pain than prescription drugs.
And now the president has established a new White House commission to study opioids. And do you just want to comment on that? That's the announcement that just came a couple days ago.
Well, you know, I heard the Attorney General here in Massachusetts mention the other day, she said, you know, there's lots of studies, there's lots of research, lots of people have come together on this. What really seems to be needed would be the resources. So if there are other ways to manage chronic pain that can be widely used, and also the Accreditation Association for Hospitals, they were actually part of the problem. When they listed the fact that no patient should end up leaving a hospital in any type of pain, you know, what's a physician to do but to write a prescription for more painkillers? Probably not a good answer, but they've actually amended their look at that.
Right, that's correct. The Joint Commission standards are now changing as we speak, aren't they? Yeah. So many challenging issues. Let's move on, hearing more about your view on life as a former police chief of two major cities, actually, Seattle and Buffalo, right? And if you're a police chief looking at the intersection between criminal justice and public health, what sort of issues sort of pop up for that person?
Yeah, I mean, last month I felt I was in Buffalo, living in, being here in Boston. Thought you'd escaped winter, but I think the intersection is tremendous when it comes to drug prevention, treating drug addiction. You're seeing many more law enforcement agencies much more involved now in getting people into treatment rather than getting them into incarceration. You're seeing in Massachusetts, it's clearly Quincy and others have been a leader in this, and that is the issuing of naloxone to police officers, not just paramedics. And the number of saves is tremendous. People sometimes then mention, well, then they'll just go back to using and on and on. But frankly, saving a life and having met, as you did, and as the governor did, having met literally thousands of people that are in recovery. They had a drug addiction problem. They're tax-paying, wonderful, contributing citizens as a result of treatment. Doesn't always work, but it makes a huge difference. So that intersection where we're all partners makes much more sense than trying to deal with this issue in silos.
Yeah, and that way law enforcement has become another public health effort, hasn't it?
I think it's always been somewhat of a public health. If you think about who's out there 24/7, they're pretty easily recognized, and they have a very easy to remember phone number. The law enforcement is almost always one of those first responders on mental health issues, on public health issues, et cetera. And what they need to do, I think, is to support more in the funding for research and more in the resources in those other agencies that are actually better at dealing with mental health and drug issues than the law enforcement officer is.
Now, currently the concept of sanctuary cities is in the news, getting a lot of attention. Do you want to just comment on that as a former police chief?
That's come up a lot, and certainly places like Seattle. You know, the rumor is that Seattle's a bit liberal. I don't know if you've heard that. Seattle or San Francisco or others, but if you look at just about every city across the country, when a chief of police, takes an oath of office, they take an oath of office to protect the people in that jurisdiction. They don't take an oath of office to only protect American citizens within that jurisdiction. It's everybody within that jurisdiction. And so it's less about being a sanctuary city and more about making people not afraid to come to the police. And I'm very concerned that Los Angeles just recently released some statistics where they looked at the number of complaints being made about sexual assault and domestic violence by Latinos. And those numbers are down since this election. I doubt if those two crimes are down, but if there's a chilling effect on people being afraid to come to the police because they think they're also part of immigration, that's not healthy for safety and security.
And you've had a major role also in advancing community-oriented policing. I'm sure that concept overlaps with what you just said.
Yeah, it's been around for a good close to 30 years. When it was first introduced that you should be more community and engaged as a police officer, most police officers said, look, I joined the department to put handcuffs on people and to drive fast. And but over time, it became very, very clear to even the youngest police officers that merely making arrests, merely responding quickly to a crime, in the long run wasn't going to be as holistically good for a community as building up other resources and actually preventing crime.
So tell us about the future of the intersection between law enforcement and public health from your point of view, from a former police chief's point of view. Where do you think that's going?
That intersection is only going to continue to grow. I think there's just strong recognition on the part of leadership in both of those camps. Law enforcement, whether it's the unions or the head of police departments, or whether it's within the public health system, that we need each other very much. We all live within finite resources, whether it's at the local level, the state level, or the federal level, and it's going to be very critical that we leverage those resources. Dealing with mental health crises and being able to prevent someone from either taking their own life or committing a crime. Mental health professionals are by far the best to do that.
Thank you. And then let's hear more about your most recent role as Commissioner of Customs and Border Protection. Tell us what the public health community should know about that very important part of government.
During the time that I headed Customs and Border Protection, it was always referred to as we're going to introduce the head of Customs and Border Patrol. And the only thing that is really thought about with CBP is the fact that it is about border security, because you have the United States Border Patrol, you have Customs and Border Protection officers at 338 ports of entry. But every import in the United States, every export, the collection is, as Betty mentioned earlier in the introduction, the collection of a very large amount of revenue. I mean, frankly, if they do away with the IRS, it's going to be up to CBP to support the entire federal government, which may be a difficult task. So it is a wide-ranging portfolio. But I was delighted when the president nominated me, and then to be confirmed by the Senate. And during President Obama's administration, I was the only confirmed commissioner of CBP, which is an interesting leadership issue, because as good as people are in those acting positions, you need the imprimatur of the Senate. You need the support of that other branch of government. And so being confirmed by the Senate made international negotiations, made the leadership of the Border Patrol and Customs and Border Protection officers a bit easier.
Mm-hmm. And say more about the public health ramifications of all this.
The public health, I was confirmed in March of 2014, and within a week I was in McAllen, Texas, in the Rio Grande Valley. That was the beginning of 68,000 unaccompanied children coming across the border, and you know this issue extremely well. But when it first began to eclipse, all of the children coming across the border, the only people to greet them and deal with them, and they weren't running and hiding, they were turning themselves in, was the United States Border Patrol. There were no other resources available. So there was no health care, there was no food service, there was no security, and we had kids in rooms like this sleeping on concrete floors under space blankets. I watched Border Patrol agents microwaving burritos. I watched them bring in their own children's clothing until the rest of the government, the rest of Washington, D.C., actually stepped up to the plate. And HHS was, of course, one of those groups to step up very quickly and to help with really just such a huge number of kids making their way across that border on their own.
I remember when that issue consumed our department, Health and Human Services, and we worked closely with Homeland Security. That was a couple seasons. Is that issue still ongoing?
It is still ongoing.
Okay.
2014 was the high point, 2012, 2013, and we're talking about fiscal years here, but 2014 was the high point. 2015 was a bit of a downswing, but then 2016 it came back very strongly. But it looks like things, given what's been talked about on immigration today, it looks like the numbers for these last couple of months are certainly down.
Okay. And then in the midst of all this, the president has announced two versions of a proposed travel ban that's being held up in court right now. Tell us your thoughts on that.
So the travel ban, when it was first proposed and talked about, essentially said, look, there are 6 countries, I think 7 to begin with, right. But there are 7 countries, and we are going to hit the pause button on people coming from those countries, and we're going to look at how do we review that these are people that are not going to do harm to the country. I actually felt, that it was certainly within the authority of the president to do that. I felt that saying we're going to hit the pause button, I think for 90 days, is not something that has not occurred actually since 9/11. Those things have continued. Every part of our travel system, our air cargo, our imports and exports, every part of it has been reviewed and looked at. What was so devastating about this was the ham-fisted way that it was rolled out. 4:43 on a Friday afternoon, the president signs the order. The Secretary of Homeland Security is only told about it while he is on an airplane. And now you're going to expect 60,000 employees around the world from CBP to all understand and deal with this in exactly the same way. Whether you're landing at Logan or whether you're landing at JFK. Well, you actually can't do that. You actually need people to have an understanding and what are the rules and why. And you need to educate people coming from those countries. Remember, that included people with visas. It also included lawful permanent residents. Lawful permanent residents actually can vote in the United States. There was probably no reason to include them, but it really kind of shows you that it wasn't very well thought out.
Do you want to project what's going to happen in the future with this issue? Or?
I wouldn't be surprised if the courts are going to side with the most recent case that what he's done and what's being done is within the legal parameters. I think that what's more important is how do you communicate to other governments and other countries, to their ambassadors, what's going on and why. And no matter what, you can't get out from under that umbrella of the statements that were made during the campaign about a ban on Muslim to then say, well, here are 6 countries or 7 countries or earlier which have predominantly Muslim populations. I think that's hard. The other part to remember is that there are a lot of people that come to this country every single year for tourism and for business. And it is a tremendous asset and benefit to our economy that they come. If we make the message that you're not welcome or it's going to be very difficult for you to come here, that can have an impact on our economy.
So Gil, as we look back on your extraordinary career, you had a run in public service that's gone almost 4 decades, is that right?
A little over 4 decades,
Wow.
but you were being kind. Yeah, so thanks.
So tell us from a very personal point of view how you had the stamina to do this. And what are the leadership lessons our students can get looking at a career like yours?
I mean, I think the leadership lesson, and I don't think it's particularly different from when I talk to doctors and about interns and the amount of hours and the time that you put in a hospital. So one, you have to have an incredible work ethic. Everyone is kind of watching you as a leader, and if you're not putting in the hours and putting in the time, that's a mistake. I think the second part is you have to be a good communicator. You know, you're no longer a manager, or you're no longer an executive, you're a leader of an organization. So they want to hear from you and they want to see you. And with CBP being in 40 different countries, that's an awful lot of airplane travel. And the last lesson, I think, is that people have to know you care. I had a number of Border Patrol agents that were killed in the line of duty during my time at CBP, even during those 3 years. And those families and those Border Patrol agents have to, you have to exhibit that you care. To say, well, I'm a very strong leader and I'm not going to cry, or I'm not going, et cetera. People don't know you care unless they know you care.
Final thoughts on leadership lessons for our students in particular as they look to their futures?
Yeah, I think those 3 things are particularly good. We were fortunate the other day to have Secretary Clinton come and speak to a small group at the Kennedy School. And the student moderators asked her, well, what about, what are the books that you're reading right now? And she said, I know you all have a lot of reading to do as a student at Harvard. She said, I'd really encourage you to perhaps spend more time talking to people, listening to people, and particularly getting the viewpoints of people that you may not agree with or that you may not understand. And I think those people skills are as important as these skills.
Absolutely. Yeah. Gil, if I can say, our country owes you a debt of gratitude. Thank you so much for your decades of public service.
Thank you, Hal.
Thank you. Thank you.
If you are interested in supporting this program and others like this from the Leadership Studio at the Harvard T.H. Chan School of Public Health, please call 617-432-1318 for further information.